Hey everyone, my name is Bianca Hurd, and I'm conducting a program evaluation at Urban Rehab. So, Urban Rehab is a nonprofit that offers prevention, early intervention, and outpatient programs to individuals and communities that are impacted by mental illness and addiction. In particular, I'm conducting um, a program evaluation on Urban Rehab's outpatient program. So, the outpatient program usually lasts about 12 weeks. Individuals are referred to urban rehab by local hospitals, drug court, and DHS. During the course of this program, individuals are required to remain sober, obtain a sponsor, and attend AA meetings, and of course, just complete tasks that the clinician and therapist give them to do to when they come in sessions or group session. Um, so the purpose of me conducting a program evaluation is to see how successful is Urban Rehab's program, outpatient program as a whole. I want to see just how many people remain sober um, after graduation. Due to statistics, only 1 in 5 people remain sober after treatment or after inpatient or outpatient treatment. So I just want to know how many people that are successful from Urban Rehab's outpatient program. So, like I said, I'll start by giving a brief description of the agency and the program methods. So Urban Rehab also offers adventure-based programs for adolescents and the youth from ages 8 to 12 with behavior modification, strength-based therapy, empowerment, social skills training, and assertiveness training. Urban Rehab offers housing for everyone who's in need and voluntary aftercare for clients that are in recovery and have graduated from the program. Urban Rehab interventions are based from the social work's 3 models of social practice, which are micro, meso, and macro practice. On a micro level, Urban Rehab's goal is to provide a direct individual, group, and family therapy to a special population in need of stabilization, rehabilitation from mental illness and substance abuse. On a meso level, Urban Rehab's goal is to assist and prepare communities and neighborhoods with the education and organization to accommodate special needs the special needs population within the existing community. On a macro level, Urban Rehab's goal is to be actively involved in the community and advocate for individuals and communities that suffer from low income, abandonment, mental illness, substance abuse, and homelessness. So currently, Urban Rehab does not have a evaluation in place to measure their outpatient program, but they do have a tool in place known as the ASAMS, which stands for American Society of Medicine. The tool is an evidence-based approach that is widely used today. ASAM has been an accredited provider of continuing education since 1977 and is a recognized leader in the planning and presentation of educational events in the addiction field. ASAM's educational programs prepare physicians and clinicians to translate the power of science into high quality services for patients, their families, and communities. Though its publications, journals, textbooks, and educational programs, I'm sorry. Um, okay, so ASAMS addresses the most fundamental questions about addiction, ranging from helping physicians and clinicians understand how drugs act on the brain, fostering the adoption of new treatment interventions and responding to emerging problems such as the misuse of prescription drugs. Alright, so we'll go into the methods of the program evaluation. The single system design will be utilized for this evaluation. A single system research design is taking repeated measures of a dependent variable and applying an independent variable of a single system. The single systems research design assesses a factor such as a program outcome measure, target, behavior, or dependent. In this evaluation, the individual variable will be the outpatient program, and the dependent variable will be the clients who have graduated from the program. Data of the client's progress with sobriety from the beginning of the outpatient program, the end of the outpatient program, and their progress 6 months or more after the program will be evaluated. One of the limitations of the design will be the fact that the research and data will be the progress from the client's own perspective and not from the clinician perspective. It is a possibility that the client could be biased in completing a survey or on their own progress with their sobriety. It is also possible that some of the surveys will not get returned, and one of the reasons may be due to change of address or just the client just not wanting to participate. So Urban Rehabs measures the progress of their clients through ASAMs, like I mentioned before. The data that is collected from the surveys of the client's progress 6 months or more would also be measured based on will also be based on the ASAM crosswalk criteria. So the data from the client's progress with sobriety at the beginning and the end of the program will be retrieved from Urban Rehab's database. Limitations would be that ASAM's criteria may not have been utilized in evaluating the client's progress with sobriety at the beginning, the end, or either time throughout the course of the outpatient treatment. If this occurs, the data collected from the surveys will be insufficient because we won't have any data to compare or even track the progress of the client. So the evaluation of the program will be conducted by myself and 4 other Jackson State interns. Surveys will be created based from the ASAM's criteria. Data will be collected from about 100 surveys that are mailed out to the clients' residencies. Consent forms will also be mailed out for us interns to review the client's records. So the clients will have 6 to 8 months to return the survey. If the survey and the consent form are sent back, the next step will be to measure their progress using the ASAM's PPC crosswalk. After measuring the client's progress from the survey, the next step will be to review the data that was retrieved from Urban Rehab's database to compare ASAM's PPC crosswalk of the client from the beginning of the treatment, end of the treatment, and 6 months or more after the treatment. Alright, so next we'll go into the data analysis. Data will be displayed and analyzed using the ASAM's PPC2 assessment dimensions. The 6 dimensions include Dimension 1, acute intoxication and withdrawal potential. Dimension 2, 5 medical conditions and complications. Dimension 3, emotional behavior conditions and complications. Dimension 4, treatment acceptance, resistance. Dimension 5, relapse continued use potential. Dimension 6, recovery environment. Okay. And so that chart would be used in the ASAMS PPC2R crosswalk, which is also the risk rating in the 6 dimensions. On this graph, a client's progress is analyzed on each level of dimension, ranging from 1 being low, 2 being moderate, 3 being high, and 4 being severe. Next, the scores are calculated and divided by 6 to determine the level of care of the client. A score of 4 will be hospital inpatient, 3.5 through 3.7 intensive residential treatment, 3.1 through 3.3 low intensity residential, which could also be like a halfway house. 2.5 1 CP day treatment, like a day treatment at least 20 hours a week. 2.1 intensive outpatient from 9 to 20 hours a week, and 1 being outpatient at least 9 hours a week, or 0.5 which will be early intervention. Alright, so next will be the sharing results. So data will be presented by a PowerPoint. The data is how successful the data is based on just how successful the outpatient program is by presenting the client's progress with their sobriety from the beginning of the program, the end of the program, and 6 months or more after the program. The scores of each client will be presented from each assessment to explain their sobriety progress. The data will be presented to Mr. Massey Mr. Massey, the licensed clinical social worker, and the CEO, and Tony, the therapist. We expect the data to be utilized by showing them just how successful is the outpatient program at a rehab by assessing how clients are utilizing the knowledge and skills they've learned in the program to remain sober. Okay, so timeline. It will take us about 2 to 3 months to create a sufficient survey based from the ASAMS criteria. Next, the survey and consent forms will be mailed off. Clients would have about 6 to 8 months to send the information back in. After information is received in, it will take us about 2 to 3 months to analyze the data and prepare for the presentation. So the budget part will be the expected cost of the evaluation. We'll give an estimate about $2,000. Most of the cost will be from just the cost of ink and just mailing out the surveys and the consent forms, and just cost of paper. Urban Rehab will not have any staff to assist us, so the rest of the cost will be just paying us interns for conducting the program evaluation. So also be no equipment required. So basically, like I stated before, the whole purpose was to see um, just how successful is Urban Rehab's outpatient program, because they don't have anything or any evaluation in place or any follow up procedure to just check on or follow up with their clients. And so, like I said, they do have ASAMs in place, but it's to evaluate the progress of the client while they are in the program, and not the program as a whole. So we kind of use the tools that we use were the ASAMS criteria, so we can evaluate the progress of the client um, current state by the ASAM criteria when they send us the information in, and we base those surveys off of the ASAM's criteria. That's how we created the surveys to send out to clients. Um, yeah, I'm just trying to see what all I missed or I didn't cover. Um, and just like I said, basically, when we do present this information to Mr. Massey and Mr. Tony, hopefully they'll take the information and they can utilize it by seeing how successful their program is, and what they need to improve and what they need to include and what they need to change. Um, and before they did have a aftercare in place, like for people that are recovering, but it wasn't they weren't evaluating the clients. It was just after, like, just an aftercare program, and like I said, they don't have any way to evaluate their program, and they don't have any way to follow up with their clients. So we were hoping that the survey that we created, they can keep the survey, and every 6 months they can send it out to new clients, and the clients that we chose was just a random sample. um it wasn't anyone in particular. So they can, like I said, they can utilize this data by just seeing how successful their program is, and just hopefully they can utilize it in the future to send out to clients, just to check on their progress, the clients that have graduated from the program. um um, so I think I basically covered everything. And like I said, hopefully, by them seeing how successful their program is, they can maybe present this information to um, the board of mental health centers, because I know that right now their urban rehab is trying to be funded by the Department of Mental Health centers. So maybe they can present this data that we collected from the program evaluation to the board, and they can show them just how successful their program is. Um, I think I just basically covered everything. I was just trying to see is there anything I missed. Yep, I think I covered everything, and thanks for your time, and um, thank you again. Have a great night. Goodbye.